Hello and welcome to this International Longevity Centre UK webinar on data, bots and drones, transforming access to health through technology. This session is supported by Sanofi. You're all very welcome. I'm delighted to have so many of you with us. We have a very diverse group of attendees and also a diverse panel of speakers, which you'll hear from shortly. My name is Gary Finnegan. I'm a health journalist and I'm the editor of Vaccines Today. And we're joined, as I said, by a range of experts from a really broad number of perspectives from policy making and from civil society and from health professionals. I'll introduce them all in more detail, but just to give you some insights into what to expect, we'll hear from Daphne Holt, who's chair of the Coalition for Life Course Immunization, from Chris Green, who's MP for Bolton West, from Sibylla Colici, who's executive director of Vaccines Europe, from Philip Weiss, who's the founder of ZN Consulting in Brussels, and from Dr. Wendy Yarrod, who's director at the Association of the European Cancer Leagues, Professor Irka Botten, who's professor of cybersecurity and head of the School of Computer Science and Informatics at De Montfort University, and from Maggie Ellis, board member of the European Knowledge Tree Group for E-Technology, the EKTG. We'll also hear in a moment from David Sinclair, who's the director of the ILC, and he'll be presenting key findings from a report produced with the support of Sanofi on, which has the same title as this event, in fact, of data, bots and drones. Can technology increase uptake of adult immunization? So although we are speaking of health in general, the focus also is on immunization and vaccination. And even if it weren't, I think we'd end up there anyway, because that is where a lot of these conversations are happening right now. So throughout the afternoon, we'll look at some of the ways in which digital technology can improve access to health and uptake of vaccinations across the continent of Europe. And our panelists will share their various insights on this perspective. A few housekeeping things before I move on to the meat of the event. So at the bottom of the screen, you will see Q&A feature. I'm sure you're all Zoom professionals at this point after 18 months living by Zoom, but please use that Q&A feature to ask questions, and we will try to come to as many of those as possible at the end of the session. You can also use the chat function to connect with panelists, but for questions, I'll be going to the Q&A after everyone has had their chance to speak. In the interest of time, please do ask questions that are relevant to the session and to the speakers. If you're having any difficulty with the link, just reconnect. The same link will work throughout the afternoon. And of course, as always, the conversation continues also online during the event and afterwards, and we're using digital health as a hashtag digital health, and also you can tag at ILC UK, and we'll follow the conversation there. As you will have seen when you joined, the webinar will be recorded and is being broadcast live on YouTube. It'll be published for public access afterwards on the YouTube channel and the ILC UK website, and all the presentations will also be available. And so a reminder again to use that hashtag digital health and also to ask your questions below, and we will come to those after the panel discussion. But without further ado, let's get on with it. And let me introduce to you David Sinclair, who's the director of ILC. Briefly, I think David will talk a bit more about the ILC's work, but just to say that David himself has been working in this field of policy on and research on aging and demographics for 20 years. He holds honorary positions at UCL and at Newcastle University, and has presented on longevity and demographic change across the world, from Seoul to Singapore and Sydney to Stormont, and I presume at places that don't begin with S as well, David. David has a particular interest in older consumers, active aging and financial services, and in adult vaccination. And I think you'll agree that in all of those, technology and its role in an aging society is a central piece of policy making. So David, thank you for having us all here, and over to you to show us some of your findings in the report.
Great, thanks, Gary. So I'm perhaps very quickly, for those of you who don't know, the International Longevity Centre, we were established in 1997 as part of a network of organisations interested in longevity. There are now 16 ILCs across the world, and we describe ourselves as the specialist think tank on the impact of longevity on society. So we're fundamentally interested in, look, there's more and more older people in society across the whole of Europe, across the whole of the world, actually how should public policy adapt to that sort of opportunity as well as challenge. Um, so and to declare our interest, this piece of work was funded with support of a grant from Sanofi, and we're very grateful for their support. So essentially what I'm going to argue in sort of 10-15 minutes or so is technology has a really important role to help us improve the uptake of adult vaccination. I think what we've seen is through COVID that there has been sort of huge progress made very quickly with the use of technology. There's absolutely no shortage of ideas as to how to use technology, but actually there are some challenges out there. There are challenges to make the most of technology, whether they be around privacy, digital exclusion, or indeed funding, but we'll come back onto those. So the background of this is back in 2018, we did a piece of work looking at, how adult immunization trends may change in the light of the issues around technology. And we looked at everything from sort of material science and blockchain through to the sharing economy and better use of data. And we then went over to and did a bit of a futures workshop in Brussels, where we talked about the barriers to uptake of adult vaccination, but particularly focused on how technology might help address those barriers, and then where there may be some policy issues that are impinging on the potential. And many of our speakers today were involved in that session we did. So I won't say very much about this because clearly in the light of COVID, there is a lot more, a much greater awareness of the importance of adult immunization. It's relatively new, it's worth saying. In the UK, we've only had an adult recommendation, and that was for influenza since 2000. So we've only really had about 20 years of really focusing vaccination on adults. Historically, much of our focus was on children. But it's clearly the case that as we are aging as a society, and as we're seeing more and more innovations, that vaccination has a really important role to help us live healthily. So, and we know vaccine preventable diseases, even before COVID, communicable diseases have a significant health burden. So flu might be 40,000 to 200,000 deaths a year across the EU. Pneumococcal disease is often forgotten about, but very significant burden of health. Herpes zoster, we have new vaccinations in that space as well. So there's really important role for us to think about the role of vaccination as part of healthy aging. And yet, and this slide's a bit old, but it was sort of deliberately old because actually not very much has changed. What you see is across Europe and across the world, indeed, very different levels of uptake. So this is uptake of seasonal influenza by age, but for people aged over 65. And you see the UK does pretty well relatively. Last year did extraordinarily well with flu vaccine, the highest we've ever had. But we actually see across the whole of Europe and the world very different, significant differences in uptake. We've also got a European policy context where clearly the Commission and the Parliament and the Council are all particularly concerned around healthy aging and the role of vaccines, and have been for 3 or 4 years. And at the same time, we've got growing interest from people like the WHO, from policymakers, from government, from companies around the potential for new technology to drive improvements in health. At a European level, what you've seen most recently is the big investment at EU level in joint action on vaccination, which has led to a European vaccination information portal. So, which was one of the things we actually talked about in the report as being a potentially really important resource to have. So you've seen a bit of EU action, and then at the moment, and I think this is why we're really keen to do this now, there are some really interesting European opportunities And clearly some really interesting opportunities as well for the UK in the space. But at a European level, you have a European Commission Green Paper, which talks on aging, which talks about the importance of digital technology to improve health. The highlights how the particular benefit in rural areas, but does flag this question of digital skills, connectivity, and actually how you maximize the potential in this context. And then going forward, the next sort of few months, in particular, we've got the EU pushing forward in terms of its work on the digital transformation of health and care. And I will leave colleagues who are much closer to that to perhaps talk about that. But there's clearly some really interesting opportunities going on from that point of view. I was going to run through sort of the 5 or 6 areas where there's a bit of potential, and then open up the discussion around policy. So first one, and I think this is the really strong, this is the strongest opportunity, and COVID has highlighted the value of better using and understanding data to deliver improvements and health, and indeed in this case higher uptake of vaccination. The potential to use data for monitoring vaccination coverage, monitoring the spread of communicable diseases, and better identifying target populations. What COVID has shown is this is absolutely possible, and it's really important. I think we learn the lessons of COVID and continue to use some of this data going forward. In terms of the first one, is the better monitoring of vaccination coverage. This is quite old, and the reason this is quite old is because I think I stole it from David Salisbury, who some of you will know is the former DH head of immunization, Department of Health head of immunization. In the UK, we have a really I would say an astonishingly good system around the way we manage seasonal flu in the UK, in that we have weekly data which is made available to the Department of Health and goes down to GP level. So fundamentally, if you're a manager in the in the Department of Health, after week 2, you can see that ultimately that a GP in Bognor Regis has not vaccinated anyone against the flu, and they can pick up the phone. You can do direct management, and typically what will happen is they'll say, "Oh, our fridge broke," or something, something's happened. But actually, this allows for really good management. It's one of the reasons why the UK is actually pretty good in this space. So much more potential in terms of surveillance using big data, and we've seen that with the Zoe app in the UK. Some of you will be aware that for a long time Google had an initiative called Google Flu, where Google Flu was ahead of the American government in the CDC in America in predicting flu based on search terms. Really interesting. Of course, people know what they'd worked out, what people searched for when they had the flu, and they'd mapped that onto maps. Really clever, and I think lots of potential there. But equally, similarly as say, the Zoe app in the UK is a really good example of how we can use some of this technology to monitor spread, and really important. In terms of identifying target population, again, lots of potential, I think, to use data better to identify people who we might want to communicate around vaccination. So clearly there are challenges and opportunities with things like GDPR, but actually the potential to use data to identify people who would benefit from a vaccination, and then using that as a tool to communicate, to make sure we're communicating the right messages with the right people are really high. So I think there's some real value there. In the workshop we did, we had lots and lots of interesting ideas, whether it be from information campaigns for sort of personalized information through to using location data. So you might be walking past a pharmacist, and you could have something coming up on your phone saying, actually, you're probably eligible for the vaccine, you can pop into the pharmacy now. So really interesting ideas we had, and there's lots more ideas in our report. Clearly, the internet offers both huge potential and huge risk. And one of the big messages from our piece of work was, look, actually, we've really got to improve trust, and that there is a role for technology in terms of tackling fake news, and indeed supporting the increase in uptake of vaccination. I've been a little bit more, and I think sort of going forward, there is real potential around things like, data mining in terms of real targeted focus of comms, and in terms of supporting using the internet to support really powerful online arguments around sort of the case for good health and the case for example, adult vaccination. um, there has been some developments in this area, and I suppose I wanted to flag this because actually, there is this story that the internet is all terrible and it's all about fake news, and the world is all, that actually it's making our life so much more difficult. And I suspect Philip later may have things to say about this, but I think my sense is that actually, over the last decade, a decade ago, there was not doctors on Facebook and on YouTube, and now you have doctors with 1 million plus followers who are really engaging in good science. And I think that what you've seen is that actually that that actually we have been a bit slow at reacting, arguably, to the potential of using technology to communicate messages, but I think it is starting to happen. You've got um, all sorts of initiatives in England, the flu fighter campaign. You've got medical associations engaging in a way that they haven't. You've got, I quite like the Reddit Vax Happen group. My 14-year-old son is a big fan, so I would encourage you to have a look at it. It's quite an interesting approach to sort of challenging to sort of some of the fake news around science. In terms of the online messages, I won't say very much here because we have Philip here, and I've stolen something Philip said at one of the previous event. Clearly, we have to make sure that we are using the internet well, and Philip's argument was walk in the shoes of the patient, invent new communication models, and join online conversations. So I think there is lots we can still do to improve the online visibility, and tackle some of the challenges of fake news. And again, in our workshop, loads and loads of ideas from Instagram contests to vaccination awareness days. So lots and lots of ideas in terms of how we can make the most of the internet more broadly. I'm going to rush through the last few sort of ideas. Clearly, lots of opportunities around the Internet of Things. So this is basically our connected homes and cities, and you already starting to see things like digital necklaces which record our vaccine status. So I think lots of interesting opportunities and indeed challenges in this space, but perhaps we'll come back to that in the conversation, and some quite fun ideas around it from there. And I think one a really interesting sort of one we're starting to see, and particularly may well play a role in tackling some of the challenges of digital exclusion, is the growth in voice-based services. So things like using Google Home, Alexa, Siri to do reminders for people who may not be going online. So, and I think you're starting to see some of these things happening. Gamification is another area we looked at, and there is mixed evidence, it's worth saying, around the extent to which they work, but there are certainly some games in this space that are being piloted and trialed. So, for example, some of you might have, if you haven't played Plague, I have to say I quite enjoy Plague. You try and have to destroy the world, and it's amazing how hard it is for the virus to win. And I think it's a really interesting thing to look at in the context of COVID. And but there was it's a really interesting fake news game from the University of Cambridge, which is also worth looking at. So there is some mixed evidence, as I say, around whether they work, and they're quite new, but they're worth us looking at. Sharing economy is another bit of area where we looked at, and I suppose the only thing I'll flag here is that that we have seen some pilots, and actually I think there was one which I think was a Sanofi one in the US, where they used Uber to deliver vaccinations to people who were in effect housebound. So you pressed the button or called your Uber, and a nurse turned up with a really, really interesting idea for using the tech to get to people who couldn't get out to places. And then finally, I think clearly lots of potential around AI and robots in this space. And again, I'd encourage you to have a look at the report, because there are some really, really interesting sort of ideas in this space around what we could be doing and how. We talked about sort of lifelong personal assistants, for example, that could remind us to give advice on the health behavior. I suspect it's a bit too expensive, but I think the robotics combined with your Google Home may well offer some potential in this space. And actually, one area where there has been some pilots is this. There is some evidence that you could use humanized robots to distract people from the fear of an injection. So there's been some pilots with children in particular in this space. So lots and lots of ideas. Now, what are the challenges, and what did we talk about? Why are we not making the most? And I think one thing worth reflecting is that in the context of COVID, we're using some of this tech in a way, particularly in some countries, in a way that's never been used before. And actually, we need to make sure we build on that. So, for example, in the UK, I think hopefully you can encourage Chris to talk to his colleagues. We have a really amazing online booking service for a COVID vaccine. It's national. You put your details in, and you do it. Can we not extend that for the winter for flu? Can we not extend it for pneumococcal? So you haven't got to find a way of getting hold of your GP or phoning up. You can actually just go online and just do it. Seems like now we've built this infrastructure. It seems to me like it's something that we really, really should be continuing to use. So I think we thought technology could really, really play an important role. I think particularly interested in how we develop the potential of data, big data, because I think that's probably where, at least for now, we have the most opportunities. There are some challenges: consistency of data collection, the interoperability, the challenges of different platforms, across borders. And I say across, but within the UK, of course, we have slightly different systems in Scotland, England, Wales. It's really important that we're making sure that we actually have data, and we're able to use, that this information is available across the board. I think the real potential around tackling fake news, but actually at the same time, I think really, and I'll leave Philip to perhaps talk a bit about some of the work he's been doing in this space. And there remains this challenge around privacy, which is undoubtedly a major concern for individuals, and how you make the most of technology whilst also protecting privacy. We really particularly felt it was really important that there were initiatives such as the WHO Vaccine Safety Network, accreditation for websites, which allows for people to know that where they are going is has a you can trust the information. I think that's that area is definitely developing, and you've seen it even on social media sites now. Whenever there is tweets about COVID or Facebook messages about COVID, you're seeing messages saying, link messages saying, here is a link to the UK government or the government's website. What I think one thing we've got to be really careful, and I am a bit of a geek in this space. I love the tech. I think it's so interesting, but actually there's a real risk that a lot of this is a big distraction. It becomes very expensive. We end up investing in technology for technology's sake. And I think we've got to make sure that we're using technology to help us, and that technology doesn't end up sort of diverting health spending in a way that is not helpful. So I think there is a degree of caution. In terms of what policymakers should do, and this European, I could sort of UK policymakers in here, I think we absolutely need a policy framework that will support this innovation. We probably need to regulate to support innovation, and we need to, I think, take this life course approach to vaccination. So in terms of the first one, I think we really need to know what works. Actually, there is a lot, as I was just touching on in this space, which, promises technology will solve something, and actually it may well not. And I don't think we absolutely know what works. And I think there are still opportunities with COVID for us to do a few more randomized control trials and really test out what works. I think we've got to make sure that the research environment does ensure that it creates the right sort of evidence base to support innovation, and also I think we've got to make sure that the innovation we have actually focuses on tackling the inequalities. So for example, there is a big risk that what you end up doing by moving everything online is you enhance inequalities in health, because the only people who use it are people who are already digitally engaged. And I think it's extraordinarily important that we think about how we manage that risk. In terms of supporting innovation, and there is legislation in the UK and in other places around universal design, accessible design. Basically, if we do not create products and services which, if we create products and services which people find difficult to use, they're not going to use it. And actually, it's really, really important that we are whether that be the internet or other services are usable. I think we've got to ensure innovation isn't hindered by data protection, whilst also, we would argue that there's a really strong case towards moving towards individual ownership of data. And I think that this is probably one of the big challenges for governments over the next 5 years, is how we manage the opportunity of data versus the challenges of individuals getting very worried about how that data is being used. And I think the individual ownership of it is a way of doing that. And then and then perhaps finally, I think I'll just come to sort of I think really an overarching sort of point really is that given the context of our work, is that we think there's a really, really strong case, and I think COVID enhances it, to continue to develop public policy around life course vaccination across the whole life course, and I think in doing so and using sort of technology, we could see very significant benefits to public health. So in summary, we do think technology has a big role to play. I think there are loads of ideas, and in one of our reports, we've got a list of about 20 or 30, some slightly random ideas and some slightly mad ideas, but there are some really interesting ideas of how you could use technology. But I think the challenge now is for sort of policymakers and others to think about how we can make sure we maximize this. So at that point, I'm going to stop.
Great, thanks so much, David. That was fantastic. And yeah, there's absolutely loads in there. Something for everyone, I think. And the last of your 3 summary points was on life course immunization, which I think moves us neatly towards Daphne Holt, who's the chair of the Coalition for Life Course Immunization. I'll introduce Daphne, even though I know her really well, because she's on the editorial board of Vaccines Today, and I'm involved in the CLCI as well. But Daphne joined the world of charity management in 1999 after 30 years in medical research, first with the UK Medical Research Council and then with Imperial. She helped to found, or she really founded, I think, herself, the Life Course Immunization Coalition, or the Coalition for Life Course Immunization, and she's now the chair. As I said, she's a member of the editorial board of Vaccines Today, and generally an advocate for vaccines at all ages and stages. Daphne, what jumped out to you in that report?
Thanks, Gary. And I'd also like to thank David and ILC for asking me to speak at this symposium. The first remark I'd like to make, actually, is to commend the ILC for this excellent report, which is full of innovation. But it lacks one essential element, and David has alluded to this: the views and the needs of the end users of vaccination. And that's where I'm coming from, really. I've been asked to reflect briefly on the following points in the report's finding. How digital technology can help improve access to health and the uptake of vaccination by adults, the potential of e-health and data to improve health across Europe, and what can member states and the Commission do to maximise the potential of technology to improve outcomes for the European population. And I'm going to address the last point first, because actually the answer is easy: improve the infrastructure. The report highlights a remark made by Dr. Michael Greenberg during the meeting on which this report is based. And Michael asked, what is the effectiveness of a perfect vaccine that never gets into a patient's arm? And the answer, of course, is zero. And similarly, all the innovation in the world is useless if it cannot be accessed because of poor mobile phone coverage or because of an unstable internet access, particularly in rural areas. And it's also worth remembering, as I think David did allude to towards the end of his talk, it's also worth remembering that there remain people, often the most vulnerable, who don't own smartphones or even a computer. And even if they do, they may not be up to speed with all the whizzy things that we can do with them. And this aspect was brought home sharply to me at the beginning of the year when trying to persuade my elderly and vulnerable neighbours that they really should be vaccinated against coronavirus. They have a computer, but no mobile phone, and both are essential for making an appointment online. And we too here in France had a very good appointment system online. But also this couple had no information on what the procedure was. Actually, how did they have to do this? And it was therefore even more complicated for them. I did ask them, notwithstanding the issues we were having at that particular time, if they thought that technology could improve their access to healthcare. And their answer was simple: but we've got a doctor for that. Now, this couple are in their 80s, so they rely on their doctors. They trust their doctors, as we know. Now, this is just a tiny vignette, but it's not uncommon in rural areas, amongst the elderly or among hard-to-reach populations. So the second point, and this is going up my list, e-health and the use of data. I Googled e-health just to see what others had to say about it. And the WHO, in a draft regional action agenda, put it like this: the use of e-health can give people in rural and remote areas access to quality care, empowering patients and communities to engage at all levels of the health system and providing timely information for prevention, diagnosis, and management of illness. Now, I really want to believe that, but given my limited experience in living in a remote rural area of Northwest France for the past 20 years, I think it's actually far from reality. For the main reasons of connectivity or lack of it, and a lack of information where it's really needed on the ground with the people. The Massachusetts Institute of E-Health, on the other hand, had this to say: e-health provides a high potential platform to transform healthcare practices and workflows through computerized information and decision-making systems that facilitate and coordinate the care of patients. And for me, that's spot on. It is the connectivity between healthcare practices and practitioners where the most good can be done. For example, and David also reiterated this, I think, Professor David Salisbury pointed out in the report that there is potential for call and recall systems for vaccination to be introduced using GP registers, which could be triggered by a number of factors: age, vulnerability, including pregnancy and chronic disease, or seasonality, such as influenza, and almost certainly now for COVID. And it was also pointed out in the report, which was definitely reiterated by David, that the better use of data opens up possibilities for better monitoring of coverage, the coverage of the uptake of vaccination, the spread of disease, and for targeting information for communication. And the final point, which was at the top of my list, allows me to round off my part. Can digital technology help improve access to health and the uptake of vaccinations by adults? And as I've just summarized, for me, there are three key areas that need to be addressed before we can really say yes to this question. The first and most obvious is better infrastructure, especially in rural areas. Here in France, this is being addressed, and in the next 3 to 5 years, we should all have high-speed broadband, please God. But is 3 to 5 years too long for what we're speaking about here? Better connectivity within the healthcare profession. However, this is another strain on an already stretched rural doctor. And finally, better and more relevant information on how e-health can actually benefit the ordinary person. And this may be down, of course, to how well practitioners can communicate with their patients about these things. And maybe we need to add courses on communication as well as vaccination to the medical curriculum, to an already full medical curriculum. Thank you.
Great, thanks so much, Stephanie. I could easily ask you lots of questions, but let's keep it all till the end, and we'll keep on moving. So our next speaker is Chris Green, who's the MP for Bolton West, and we're very glad he has time to join us today. Chris has previously been elected to Science and Technology Select Committee, as well as the Work and Pensions Select Committee and the Home Affairs Select Committee. These days he's the chair of the All-Party Parliamentary Group on Medical Research, an area or a position which he hopes to use to focus on innovative industry. So Chris, lots of talk about what policymakers should do and could do, but we're glad you're here as a policymaker. What was your take on what you heard today?
Thanks, Gary. Thanks for the introduction. Well, I think so much what Daphne and David have highlighted so far, they are actually current political conversations. This is what at least a good proportion of MPs are concerned about, are thinking about. So sometimes when people think about the political narrative, what politicians are banging on about all the time, these items, these concerns are often overlooked. But actually, behind the scenes and perhaps not very well noticed, these concerns are actually pretty important. And I think that point about the digital divide is a key aspect to this. And it's something that's inevitably going to get more and more extreme over time, as in so many ways services become online and those local services are more withdrawn, or it's more difficult to access. So increasingly people who are on the wrong side of the divide become more and more isolated, and they find it more and more difficult to get that support. I really appreciated David's point and about the COVID online booking service. So I think this is something that a few colleagues have highlighted in Parliament about using that to enable people to book the influenza vaccination this winter. I think it's going to be a very tough time with people getting perhaps their third booster jab, perhaps their first, second other jab, to make sure that this is an efficient process as possible. The NHS is obviously facing a tough time, so any advances, any improvements will be welcome. But something about the role of a member of Parliament as well, it's changed over time. MPs used to be a far more distant figure for constituents, and now in many ways an MP takes on the role, in a sense, as to some extent, as a community hub. People speak to us on all sorts of matters, from international affairs, conflicts, famines, to things of national importance, but also GP services, how they access health, and many other things. So we do have a good sense of what people's concerns are, and people are very ready to raise those concerns. So we're quite sensitive, and our concerns given to us by our constituents are pretty rapidly transmitted to ministers as well. So we'd like to think that ministers are quite responsive, but they can only work really as fast as the system itself allows. Now, I held a Westminster Hall debate a couple of years ago. So Westminster Hall is a side hall in the Palace of Westminster. You can hold quite interesting debates. And I did it on vaccinations. And there were 4 attendees, including me and the minister, who had to respond. So that wasn't a very good turnout. And I think that shows the general interest. If people are interested, politicians will be interested, and then politicians will attend. So that gives a little bit of a sense of the state of play, or at least as it was at that time. And I think broadly speaking, there are particular niche concerns over vaccinations pre-COVID. And broadly speaking, I'd say that when people think about it, they think of the course of vaccinations that children themselves go through. People think of vaccinations for the elderly, really influenza. And if you are into adventurous holiday making, then you'll think you might need your yellow fever or one or two other vaccinations when you do that. But otherwise, vaccinations are not for the adult population, is the general view. I don't want to oversimplify it, but that's the sense I have. Now, there is a huge opportunity for, in the context of COVID, in the context of the vaccine rollout, in the context of the technology, the huge contribution from the pharmaceutical sector, the huge contribution from the public health and wider health sector, that this has transformed our opportunities from being locked down, from being being in a very dangerous place to wearing masks. And I realize that not everyone's going to agree, but the Secretary of State for Health, Sajid Javid, was saying, because we've got a strong vaccination program in the UK, that means in a couple of weeks' time, we won't have to wear masks. And that's immensely positive for a great many people. I know it'll be a concern for others, but it's immensely positive for a great many. Now, I think that kind of thing transforms people's views, their concerns, and their acceptance. Now, the ability, therefore, of public health, the NHS, and wider society of communicating the need for other vaccinations is then quite a challenge, because you move from COVID to other things. You almost have to start the conversation, the narrative from scratch. Sometimes complicated scientific language in terms of what the vaccinations are, or the disease or condition it's going to prevent or protect from, makes it difficult for people to access in terms of just understanding and memory. So that kind of simplification would be very useful. Now, we do get into quite interesting territory, because Sajid Javid made a statement to the House of Commons just an hour or perhaps a couple of hours ago. And he said that where you've got a situation at the moment with test, trace, isolate, at the moment, everyone's having to isolate for a couple of weeks. He said by the 16th of August, we're in a position in the UK that with that second vaccination, you will no longer have to isolate. And for children, those under the age of 18, you will not have to isolate. So these are very clear indicators of how the system, how the NHS, how the Secretary of State can communicate a healthy vaccination program that people have confidence and trust in, can actually achieve great things and make a real difference to people's lives. And within the UK, the communications overall have been very positive. We look at the vaccination uptake, as was highlighted just before, for influenza. UK is leading in terms of the graph that I showed, and I think world leading. In terms of confidence in the vaccine uptake in the UK, it's incredibly high. But geopolitical questions over the efficacy or the value of the AstraZeneca vaccine, I think that puts a dark cloud, because people don't see necessarily the subtleties in this. And people just think, here's a vaccine and we haven't had the right information. I'm concerned about it, and questions over age groups. And if those people who are then having those concerns are called vaccine hesitant, which is perhaps a polite way almost of suggesting someone who believes in fake news. And that language, the conflation of these ideas, is a real danger for the rollout of vaccines, for confidence within the system. I don't want to talk too much about vaccines, because there are other agendas and other concerns as well. The point about data, immense resource that needs to be used far more effectively than it is at the moment. You would think from the outside the National Health Service would be perfect. It isn't. It's a long way off. This needs to be almost the number one agenda I think the new Secretary of State needs to have. Obviously, with a 5 million actually on the hospital waiting list, another 7 million who ought to be on the waiting list. That's a massive challenge. There is an opportunity, I believe, for the private sector, for pharmaceutical companies and other companies, especially digital devices. We need to hear more about digital devices, the contribution they can make, because ultimately, in my closing remarks, we need to move away from the NHS being a sickness service to being a real health service. How do we as individuals become empowered to make sure that we can maintain our health? How much money, if we just look in at wealth terms, how much money would we save by maintaining people's health? So that, I think, is the big question. Things about whether it's nice MHRA, getting these vaccinations, which are blocked in the system at the moment, getting these things through, digital access, break down the digital divide. I think these are enormous questions. And I think we're going to have an exciting few years trying to get these changes implemented. And I think the report was fantastic in getting those ideas out there.
Brilliant. Thanks so much, Chris. Yeah, definitely it won't be boring, that's for sure. But let's stay with vaccines, and I'm sure we'll come back in the questions and with some other speakers to some of those data points. Interesting one, incidentally, about kids not having to isolate if they're a contact. That's we don't have to send them all home from school, which is a big bonus, I think. But that's a selfish point. Yes, staying with vaccines and moving to Sibylla Quilici, who's the Executive Director of Vaccines Europe, which is a specialist group within the European Federation of Pharmaceutical Industries and Associations. Sibylla, straight over to you, I think, to tell us what you took from David's report and what you've heard.
Yes, thank you very much. Can you hear me well?
Perfectly, thanks.
Perfect. Thank you very much. Thank you very much for the kind invitation of today's webinar, and congratulations for the report, a very thoughtful report from ILC UK, and for their continuous engagement on healthy aging with always a holistic view and ensuring that adult immunization is not forgotten. With regards to today's discussion, and I think we are all actually well connected in that regard, but I would really like to run my opening remarks with 3 points. I think the importance is really to reinforce the critical importance of digital tools such as electronic immunization records or immunization information system, as we call them, to ensure performance immunization programs. Across Europe, in fact, the huge issue of fragmentation and the really need for an harmonized approach across Europe. And last, the importance to keep citizens at the center of this digital transformation to health, because this is critical to ensure their empowerment. So with regards to the importance of digital tools, I mean, a lot has been said. I don't want to repeat, but I mean, vaccination, we agree, it's one of the most actually important cost-effective public health interventions that have ever been implemented as primary prevention. And we are still not benefiting from its full potential. I mean, despite having, I mean, it's about 20 vaccinations today from birth to grave to protect the population. We are actually hardly reached the right level of coverage rates to protect the population. And this even in pediatrics. I mean, if we recall where we were before COVID-19, Europe was facing actually a measles outbreak, which was vaccine hesitancy induced. And it was really hard actually to anticipate it because there were no up-to-date timely data available on the coverage rates of measles at that time, and I don't think it is still. I think it is still the case today, and this is true for measles, but it's true for the 20 routine immunization, routine vaccinations that can be available in countries. So immunization information systems have been acknowledged since 2014. We are in 2021 today. And they have been acknowledged actually as an integral part of well-functioning health systems. And just to remind what those tools, and it connects with what everybody has said, an IIS is a confidential, population-based, computerized database that records all immunization doses administered by participating providers to citizens living in a given geographical area. And using this data, IIS could really help close the gaps to immunization coverage at all stages of life, all ages of life, without staying stuck to pediatrics only, or as mentioned by Chris, on having this gap between pediatrics and elderly and not covering the adults. And in that regard, those data could really facilitate the clinical decision support. So really decision-making tools for the healthcare providers to provide to their patients, really use it as patient engagement and citizens empowerment. They can really help, obviously, for vaccination coverage assessment. I mean, the example of measles and could be for outbreak controls and emergency preparedness. And last but not the least is really data to be used for vaccine safety and effectiveness assessment at large. So those tools are absolutely critical to help close the gaps in immunization coverage, as I said already. With regards to the issue of fragmentation, I think what the sentence I would like to say is really viruses have no borders. And they actually gain from the fragmentation of immunization policies in Europe to spread. And the electronic immunization record system need a harmonized approach to provide the full benefit of vaccinations to the citizens, to the healthcare systems, and to the population in terms of protection. When we look at where we are at with the European Union, ECDC actually did a report back to 2017 on the state of play of this use of IIS across Europe. I mean, there is no system alike between countries. We have 8 countries with a national system that could be a little bit like the US CDC definition of an IIS. You will have 2 countries with a national system in place that do not actually meet at all the criteria of an IIS. You will have 5 countries with more than 1 subnational IIS, so lacking even interoperability between the regions, and some countries with pilot systems. So we are very, very far away at EU level. And this was back to 2017, but still very little progress has been made for the national immunization programs per se. That said, as you mentioned, a lot has happened with COVID-19. So how we can ensure that what was done for COVID-19 pandemic are actually expanded beyond COVID-19 vaccines and in a sustainable manner, meaning that we need actually adequate funding for the infrastructure to support those tools, but we need also the interoperability of those systems within the healthcare system, which is critical. How do you link the health status of the individual with what type of vaccines it will be needed? I do think about the life course approach to vaccination with an acronym that I like very much, which is coming from Australia, which is the HALO acronyms: health, age, lifestyle, and occupation. And when you think about that, is really you have vaccines today that needs a personalized approach with regards to whom they should be administered. And only if you have a really nice, actually, digital tools that read really well, actually, how you use which vaccine for whom, can really provide this personalized recommendation to citizens. So this is critical. So funding infrastructure is important. And last, what I wanted to mention is the importance of the citizens, not to have actually a digital system that is completely disconnected to the citizens. The citizens should remain at the center. It should be empowered with regards to its immunization status. And in the same way, we could look at the paper record format. For example, we actually, for a century now, receive our vaccination records in a paper format. Why we need to translate this in an electronic format, but where the citizens still have access to it whenever he needs it, but then a tool that empower him with regards to access to information, with regards to connection with his healthcare providers, with regards to reminder system to say, well, because you're entering in an influenza season, you will be at risk, so you need to be vaccinated against influenza, for example, or because you actually have a renal surgery, you're 20 more times at risk to have a pneumococcal infections, you should have actually pneumococcal vaccines for you. So it's this type of tools which has to communicate actually to the citizens to explain why they need what type of vaccine for which purpose and when. So the citizens at the center of those tools are critical. So so for me, a successful digital health transformation requires really empowering citizens to access, understand, and trust the benefits that those new technologies can bring into their lives. So to close, in terms of closing remark, I think one of the lessons learned from this pandemic is that we need an harmonized approach to immunization policies in Europe to ensure citizens' protection and confidence towards vaccines and vaccination. It is critical that the member states provide to their citizens a way to register electronically their vaccination at all stages of their life, so not for kids only, so they remain empowered and responsible with regards to their vaccination status. IIS, or electronic immunization record, should be harmonized across Europe and interoperable to ensure that there is this connectivity within the healthcare system at national level. And there are several opportunities that the European policies today in the legislative agenda that we can make it happen. There is a European health data space. There is still the EU joint action on vaccination when we look at the work package 5, which is actually supposed to cover these issues. And we have the European Health Union package, where if we look at the role of ECDC, we definitely need actually the empowerment of the ECDC to tackle this issue. And last but not least, the Vaccines Europe is going to host actually a dedicated webinar and a podcast on the role of ECDC in September 2021. And we hope to be able to tackle a little bit more this issue with regards to fragmentation, reduce fragmentation, increase harmonization. And I look forward to the Q&A session. Thank you very much.
Great, thanks a lot. Thanks, Emilia. I wonder if some of those things had been done a few years ago, if the European campaigns would have been out of the blocks a bit quicker. It's no coincidence, I think, that the UK and Israel were ready to go when the vaccines were ready. Okay, so let's keep moving to Philip Weiss now, who is the founder and CEO of ZN Consulting. And I can attest to having worked with Phil because he's worked on vaccines today and several other online vaccines related topics. Another benefit of having harmonized information systems, Phil, would be make it easier to travel. And I know I said you're in Brussels, but you're actually in Brittany, I think, because you've crossed a border. Tell us how you did it.
Absolutely. So, I mean, I think, so I'm in Brittany, I'm on holiday, and I've used the EU COVID certificate, the app, and I want to focus a little bit on that because I think it's a really interesting example of how technology can actually really benefit people. And we've basically been in this pandemic, which has been a great accelerator of innovation. Effectively, people have been doing things and experimenting with things that they would have not done otherwise because of necessity. And I particularly find this interesting, that what's happened with the COVID certificate, because basically I think this can do three things. One is it helps with vaccine acceptance, and that's because basically you offer people a very straightforward benefit. If you want to travel and you have this certificate, it basically means that you can travel more easily. You can show people from one country to the other that either you've been tested or vaccinated or have recovered. And so basically this information is now supposed to be recognized across Europe. It's just been launched on the 1st of July. So obviously it's still relatively new, but I think it just shows the incredible potential of technology to bring together information that really benefits the citizen, but also provides a kind of integrated approach to data, something that we've talked about. Now, it means that if you use this tool, you can travel more easily. You don't have to quarantine in certain cases, and you have to do certainly less testing than before. And hopefully it gets things to be much easier. It also benefits tourism because it helps the process of travel, which I think is really critical. And I think it sets up an expectation and understanding, because a lot more people are downloading those apps, not of course just the EU COVID app, but various apps that have to do with their health profile. If you're in Belgium, for example, you can really now access information on your vaccine, appointment, information, etc. And I think it's priming people to become more comfortable with this technology and to start seeing the benefits of how this could be used in many, many other cases. Because of course, once you start saying, I can take an appointment and get a vaccine online, I can start receiving certificates, prescriptions from my doctor. There's a whole number of innovations that are taking place. And I think it's really important to look at what's happening right now, because this is a unique moment. So coming back to the EU COVID certificate, I think it can facilitate travel, digital adoption, and potentially vaccine acceptance. And I think that's really important, because basically people who might be, and Chris mentioned hesitant as a difficult word, I completely agree. And I think, by the way, in my conversations with people, I think the first thing you just say is that people are entitled to ask questions. They should challenge and they should get the information, but of course they should remain open. And when they have the data, they should form their opinion. So I think it's the dialogue that we need to have, but we need to have it online. So for some of the hesitant people, I think that the travel bonus, if you want, is the little nudge that will get them over the line and get them to vaccinate. And I think the more practical and simple benefits you can get from being vaccinated, and that can be delivered through technology, through these so-called vaccine passports, I think you can help get the numbers up by a few percentage points, which hopefully might make the difference between what ends up being the vaccination results. So I think that's one thing. It's also, of course, creating integration at a European level. And again, it's a massive challenge. And of course, you're going to have a lot of glitches along the way, but we're now going to have, for the first time, an app that's European and that works across all the EU countries and gives you information. So the question is, well, why don't you do that for other things as well? And what benefits might this bring? And I think the EU COVID certificate will probably quite quickly become an international standard, which will be recognized when you travel outside of the EU. So it opens a lot of doors and creates a lot of interesting potential. And I think what's interesting for us and for people who want to help, improve healthcare by using technology, it's to look at what's happening right now, to understand that we're in a unique situation now where people are more open, governments are more willing, and everybody recognizes these needs. So we have a once in a lifetime opportunity to bring about change of behavior, change of mindset, and bring about those new technologies. And I think this is going to lead to a much more open idea of signing up to certain apps, using them, accessing your data with all the questions about GDPR and other things. But I think it's a really interesting moment, and that's what we should focus on. I want to end, because it's to keep it relatively brief, on one thing, and David mentioned a couple of these things, in terms of fake news and social media and the impact this has on the conversation. I'm not going to go into all the details, but I do believe that platforms are being forced to take more and more measures that they wouldn't do before. And I think that's a good thing, which means that, COVID is being flagged when there's a search query. There is better information. But I think one of the most important things that individuals can do is, as soon as you vaccinate, you take a picture of your vaccine, you put it on all your social channels. And I think some people are getting a bit irritated by that, because a lot of people are doing it. And I just want to re-emphasize, this is incredibly important. Every friend, neighbor, family members that sees this is probably going to be a little bit more likely to get vaccinated. This is social proof. The more people around you are getting vaccinated, the more you reassure people who are still hesitant. So I really want to reiterate, the one thing everybody can do is share your vaccine experience and like and share other people's vaccine experience. The more you amplify that, the more you're actually helping with vaccination uptake. So that's for me. Thanks, Gary.
Okay, great. Thanks a lot, Phil. Yeah, I think the pandemic has brought out the worst and then the best in social networks. It was pretty chaotic in the beginning phases, but now you see much more health professionals and other social leaders stepping forward, and just ordinary citizens who are online. Let's shift gear a little bit and talk a little bit more broadly about health and specifically about cancer. And let me introduce to you Dr. Wendy Yarad, who's director at the Association of European Cancer Leagues. Wendy, we've been talking an awful lot about about data and vaccines, but of course, data is going to have a huge implication and already is having positive implications for cancer care and personalized medicine and so forth. So when you hear some of the topics that have been addressed in the report, what comes to mind and how it could be used to improve the care of people in the oncology field?
Yes, thank you very much, Gary. And thanks to the International Longevity Center for this kind invitation. Maybe before I go into address your questions, let me just introduce a few words about my organization so that you guys know where I'm coming from. So we're the Association of European Cancer Leagues, ECL. We're an alliance of 30 national and regional non-governmental cancer charities. So we're based in 25 European countries, not only in the EU. We have, for example, as a member, Cancer Research UK. We have Northern Ireland as a member, Swiss Cancer League, for example. And as you know, all cancer, so these organizations, they're really funded by the general public to work across the entire spectrum of cancer control. So we raise awareness on cancer prevention risk factors. We also conduct research and fund research, and not everyone knows that, other than people who know about Cancer Research UK. But if you think about that, cancer leagues, they get as much and more than 100 million in the larger countries. And this money is coming from the general public. It just really tells you how much trust the general public have in cancer leagues. So my intervention today, I want to, as Gary already said, more coming from a more holistic view. I'm going to talk about some of the actions that we've been involved in at the EU level. So of course, and also addressing what we're doing in the area of cancer control. Let me start with the EU Joint Action on Vaccination. So Sibylla already mentioned a little bit about this, and also at the beginning it was mentioned in the 2019 ILC report on data bots and drones. So this joint action on vaccinations is now in its final 12 months. It's being extended for 6 months, as with all EU projects due to the COVID situation. And this project is being led by the French government with the main objectives of monitoring more accurately vaccination coverage, ensuring that everyone in the European Union has access to vaccination, improving forecasting of vaccine stocks and systems, setting priorities for research and development on vaccination, and lastly, enhancing the public confidence in vaccination. So this is a really huge project involving many partners, many governments, member states, many NGOs, and we've been working together for the last 3 years. My organization, ECL, we've been involved specifically in the work package on integration and national policies and sustainability. And this is where we engage our youth ambassadors group. So we're a cancer organization. So of course, we're focusing in this joint action mainly on HPV, or the human papillomavirus, which is responsible for 70% of cervical cancers. And it's one of the main prevention messages in the WHO's European Code Against Cancer. So our strategy in engaging young people as ambassadors in the EU and non-EU member states is shared with the wider Joint Action Consortium as a successful case study that can be replicated to address common hurdles among all vaccines. And they've been mentioned here already: vaccine hesitancy and the spread of fake news. So we wanted to develop an effective strategy of communication. Why then did we engage youth ambassadors for this work rather than healthcare professionals or vaccination experts? Well, of course, we have the experts to support us, but we chose this part, the younger age group, to provide to implement the key activities, because they serve as the bridge between the younger and older generations to promote factual information on vaccinations. So this has already been referred to as the intergenerational learning in the EU Green Paper on Aging. And in addition, this age group in their 20s have strong peer networks, and research has consistently shown that peer networks and trusted sources are extremely effective in spreading important health messages versus official mass media campaigns. And young people, they're the masters of digital technologies, social media, and they're critical for social connectiveness, and they're key in galvanizing their families and networks in conversations to combat vaccine hesitancy and fake news. So one of the main activities that they work on is they organized, coordinated by ECL, they organized a competition during the WHO's week, Immunization Week, which takes place in April every year. And this competition was about using digital technology to raise awareness on the importance of vaccinations. And it was addressing different age groups. And again, keeping in mind that the younger age groups is a bridge to the older generation and the smaller ones, so that already in preschool, they should already be getting the information. So this competition, where we asked them to submit their entries in the digital categories of, for example, 1-minute videos, infographics and posters, digital stickers, memes and GIFs, and also to submit something in the category of country policy case studies, and that's mainly for the older age group. A lot of this, when I saw this, I said, gosh, how am I going to be able to, I don't even know how to create a digital sticker or meme, but for them, it's second nature. And we got lots of really, really interesting entries. And, I just want to mention that the competition process itself is also part of our communication strategy, because we had to disseminate the competition widely through social media. And we had a very successful snowball effect, trickling to hundreds and even thousands of channels. So getting the attention of not only young people. And the entries are really entertaining. And I would like to invite you to go to the EU Joint Action on Vaccinations website to see them. And that's just EU-JAV.com. You can also see them on Instagram with the Cancer Code account. So I want to talk about a few words on what we see as challenges and opportunities with the new European health data space. And this has already been mentioned. It's brand new. There's a consultation that's taking place right now. It's going to close the end of this month. And some of you may know that the Commission made this a priority for this year. And it's mainly because COVID made such a case for how important data is for research and policymaking. This project has three main objectives: to ensure access, sharing, and the optimal use of health data, to foster a genuine single market in digital health. So we're talking also about telehealth, telemonitoring, and mobile health, and enhancing the development, deployment, and application of trustworthy digital health products, right? So the challenges we see here is that not all sectors will have the same views on how this health data space should be shaped. We're in the field of research, so we are working in the field of research. We would welcome more clarity on the provisions under GDPR. That's already been addressed by other speakers. Some harmonization on the use and processing of health data for medical research, because the lack of these clear guidance and the various disjointed interpretation among countries has really been a barrier for all the researchers. So, for example, if you think about needing it to analyze vaccination gaps among populations, age groups, postcodes, how do you do that? Without interoperability, it's fine to have that information in one region, or sometimes even just in one hospital. But then, how do you then make sure that others can access that data to be able to use it more properly? And I think, and also it's worthwhile, and it's already been mentioned, older adults are less likely to use telehealth and mobile health options. Although I think during the time of COVID, there's been an uptake on that, because patients were either afraid or no longer allowed to see their GP. So so even GPs were kind of forced into the situation where they had to provide consultations online. So, that's one of the silver linings of COVID. But nevertheless, there's a need for digital health literacy among older adults on understanding how to use the new digital tools and on understanding the consent to share as well as the right to data privacy. And not only the older age group, but about also marginalized populations. That's also been mentioned. And these populations, they tend to be the targets of anti-vaxxers, because the anti-vaxxers know it's much easier to spread anti-vaccination information in these tight-knit networks. They don't always necessarily trust information that is targeting the more general population. So they really take the information from these anti-vaxxers to heart. So we can help the EU shape the shiniest, most promising health data space and talk about data sharing all we want, but we would still be missing the most vulnerable groups if they're left out. So we do hope to address these issues around GDPR, health literacy, encouraging citizen empowerment, increasing their trust in the new joint action. So there's a new joint action created to support this project. It's called Towards the European Health Data Space, or TDAS. And so we're hoping to be able to address these issues within this new joint action. The aim of this new joint action is specifically to develop European principles for the secondary use of health data. Finally, if we're going to affect policies at the EU and member state level to maximize the potential of technology to improve health access for older adults, we really need to include these populations when we're shaping these policies. In conversation with national and European policymakers, such as Mr. Green, whom we have here, so we can take lessons from having involved patients when we develop, for example, national cancer control plans and EU and national guidelines on healthcare delivery, access to medicines. There are a lot of lessons there that we can gain from, and just including the older populations in the development of these policies. And final words in closing, it's been said, a silver lining of the COVID pandemic is that ordinary citizens now have a renewed respect for public health, right? For the value of vaccinations and for the appreciation of digital tools. So we've been able to do contact tracing, schedule testing, vaccinations, just with our mobile phones or the click of a PC. Now, it did take the pandemic to have Facebook, Philip just said this, and other social media platforms to ban false information, fake news on vaccinations, but at least it did happen. And now, with more countries opting for the common digital green certificate for travel flexibility, we're also seeing an increased understanding on the value of digital apps. So they know that it can work for them. Now, it's true that there's a digital divide that does need to be addressed, from knowing how to use a digital tool or app or to providing better connectivity in various areas. And we will continue to face challenges to ensure that efficient data protection rules are in place so that the sharing of such data will not be abused and exploited, while making sure we're fostering legitimate research for the public health good. So those are the comments from my end. And again, I thank you for letting me be part of this conversation, which is extremely interesting. And I look forward to the discussion now that would take place.
Thanks a lot, Wendy. Thanks a million. Yeah, it feels like in cancer, just as in vaccines, there's been a real acceleration in the use of data. But maybe our next speaker will help us understand what happens when you accelerate into new territory, to extend the metaphor, especially winding roads that might lie ahead. So Professor Irk Boiten is a cybersecurity expert. Yeah, so you've been absorbing all of this, but you've been at this for quite a long time. So tell us how you feel about some of these developments in how we use data and apps for crossing borders and all the rest.
Thanks very much, Gary. Thanks for the opportunity to join this conference. I'm a technologist, and that makes me less optimistic about technology than anybody else, possibly. Right? Things can go wrong. We need to make sure we pick the right things, because computers give you the chance to mess things up at a large scale rather than doing it individually at a small scale. Sorry, I'm sounding a bit controversial here, don't I? I should, right? We're on YouTube. So we are producing a live stream on YouTube at the moment, which is pro-vaccination. And which in the recommendation algorithm of YouTube will get broadly ignored unless it generates enough controversy, which is the thing that YouTube's recommendation algorithm optimizes for. So I should do my best to generate the controversy that, insofar as we haven't seen it already.
Right.
Right. My thinking about these things is very much shaped by thinking about individual versus collective values. And that sounds maybe odd from a technologist, but it's because a lot of my research is around privacy, and coming into COVID area from the privacy angle, you need to very, very quickly counter the argument that you're weighing up personal interest of hiding information against the collective interest of saving lives, because that's absolutely not what it's about. Not for privacy. And in fact, COVID tracing apps basically are invading people's privacy massively in order to restrict them freedom of movement, right? So this is a world in which we make collective sacrifices on the basis of technology in order to collectively be better as well. So I think one strong line in talking about vaccination and talking about COVID is to take the collectivist view. I think and Philip alluded to it as already. This process of taking pictures of yourself when you've had your vaccination is possibly one of the strongest messages that you can make. It makes the vaccination message a collective one. Right, and sorry to be unkind, but the message from the UK government in the last few days has been an individualistic message. It's been, you don't have to wear masks because you are vaccinated. Yeah, and I think the message should be, we are wearing masks for each other, for the collective. Me wearing a mask protects other people more than it protects me, right? And to some extent, that narrative for vaccination is also one that we should carry wider. And from my niche area of privacy, I also believe that privacy is not about protecting an individualistic right, but it's protecting the collective right of an organization, of a society to live in freedom in many ways. And GDPR and the use of medical data for secondary purposes and all that has very, very subtle relationships with that. So technology, what technology do I think works here? Data, yes, of course, but with big data we have to be extremely careful. We have to make sure that whatever AI produces from data is fair, is equal, is explainable, and all those things are areas that we don't fully understand yet. We don't fully understand yet what bias is present in our data and what information we get out of it. And if we take that to the concrete situation of telehealth, if AI tells us what the treatment should be, it doesn't. If it's just AI telling us that, we have no medical connection to that, and we can't explain why this is the right thing, and it may be the wrong thing, but we can't tell. It's just what the data says was the right thing for people like us in the past. So yeah, a little worry about fairness, equality, bias, explainability there. But data is the core to solving lots of things, and we should at a massive scale, in a safe way, exploit large amounts of medical data that's present, for example, in the NHS in the UK, in a systematic but secure way, in order to extract maximum value from it for everybody, rather than for pharmaceutical companies. I must say that. So that's one part of the message. Data, yes, absolutely. I think there is some. We also need to look at where we look at individualistic things in e-health, the level of empowerment that's present in them. I think gamification is something that might actually work in that effect. I think if we have a chatbot which tells us how to deal, if our e-health is like Alexa, it's doomed to fail, right? It's not going to engage. It's going to be depersonalized, and people are not going to take that over their doctor at any point in their life. But if we can supplant interpersonal healthcare with little gamification things about maybe record people playing games against their own lifestyle a little bit, in which vaccination could be something by vaccinating yourself you can level up, if you want to use that sort of terminology, or you can do sophisticated risk calculations on how healthy you might be in several dimensions on the basis of data that you feed it, and on the basis of your behavior. Then people can have individual control, individual engagement with that, and gamifying that a little bit might be beneficial. I know of cybersecurity labs which spent entire months discussing every morning with each other how their sleep meters had produced interesting data overnight. Yeah, completely medically irrelevant, but the gamifying of it made it interesting and engaging for all those. So,
could I ask you just to move towards the end so we can have a last speaker? Sorry to rush you. Sorry about that. Just time will catch up.
So yeah, that's fine. I'll stop it at that. Thank you very much.
All right. Oh, sorry. Thanks a lot. Sorry to cut across you there, but yeah, I'm conscious that we have a final speaker and still a couple of questions there. Let's move straight on to Maggie Ellis, who, as I said at the beginning, is a board member at the European Knowledge Tree Group for E-Technology. Straight to you, Maggie.
Okay. Thank you very much for inviting me to be here today. EKTG started in 2010 out of a European research project where we looked at community technology in 6 countries. After that project, the people in Brussels said that the London School of Economics would be a wonderful place to expound the reason for developing technology. And I have to say that in the time we've existed, I'm afraid we have failed. Brussels told us that people were not talking to each other, and listening to many of the comments today, I would say we are still not talking to each other. It's very tragic. I commute normally from living about a mile from Parliament in Westminster to 650 miles northwest in Scotland. I realise fully well that we are not one country. And I am 100 miles from my nearest hospital in my home in Scotland, 25 miles from the nearest GP. They don't even have an X-ray machine in the GP practice. I have to travel 100 miles to get an X-ray. This is not a service. So technology has to be better. We know it can be, because when about 10 years ago, the UK did a first serious research project about using technology with real people in a small place in Newham, that's in the East End of London. They looked at 350 patients, and in a year, they saved £590 for each patient. That's saving one hell of a lot of money. And why have we not implemented that everywhere? Sadly, we've hardly done it anywhere. How many of you have your own GP records online, I wonder? I'm intrigued to know, but not that many. And even people who have don't use it. And there are problems about it. Now, David started off by saying that I was very critical about this country. I am, because other countries do it better. And in our European links, we've done a lot of work with Estonia, where 93% of the population have online access for all their records, not just about education or driving or tax, but about health. And again, why do they do it? Not because they want to be helpful, they want to be saving money. And that is what we should be doing in this country, because I think mainly we're actually talking about this country. Now, there's been conversation already today about older people not understanding technology. I would say I'm an older person. I'm probably the oldest person in this panel. But actually, very few people I know do not have a telephone of some description. Our board member, who's a priest in Edinburgh, says all that she does now is show her parishioners how to use the telephone. It's very simple, it's there. They now use the local library because they help them with technology. But people still have not got proper online access. So why is it a small country like Estonia can do it? That's because they had a company give all their children a laptop. So all their children learn about it from a very early age. They tell their grandparents about it, and their grandparents want more. So 93% of the population can do it, but I can't do it in Scotland. It's not very good, is it? But to show you that it can happen, I belong to one of the oldest cricket clubs in London. This year, instead of having a real AGM only, we had a Zoom AGM as well. And instead of having 120 people in the room, we had 800 people on Zoom. Now, the 800 people were a lot of older people. They weren't just the 25-year-old enthusiasts. So I think things do happen, they can happen, but we have to encourage them to happen. And the important encouragement is not only in wrist strap watches or link watches around your neck, it's actually the health informatics aspect of e-technology that we have to push. We have to educate the professions. There are no professional groups in this country who are taught about health informatics in their basic training. It's crazy. Why not? If you can learn about it in Estonia, make sure we learn about it here. I'm delighted that we've had Chris Green as part of this panel, because I hope he will encourage his other members of Parliament to look carefully at what's happening and wonder why, when in 2017, we all signed the Tallinn Declaration to say we would promise a digital future for Europeans, and some countries in Europe can do it. Surely we can do it better.
Okay, thanks so much, Maggie. That was very interesting and a nice way to wrap up. I feel like I'm breaking my promise to people who sent in their questions. So I don't think we'll get to run around the panelists and ask them, but I can tell you that most of them have been either answered or at least touched on by people here. A lot of questions about digital divide, bringing people in from where there's potential age disparities or other groups who are maybe marginalized. And again, using the digital certificate that was developed for COVID to build on that for other vaccines has come up several times. And the debate that we won't solve now in balancing sort of privacy and liberty with all the potential that digital tools can bring us. So let me thank you very, very much for joining us. And just before I leave you, just to flag a couple of events that are forthcoming. If you go to the next slide there, in July, on July 15th, you'll see this event is free to join, just as this was on COVID in the UK and the US. And that one is in the afternoon UK time. And then I think later in the year, towards the end in London in December, the future of aging. And I think David mentioned this at the beginning, reimagining aging in a changing world. And it's impossible to imagine that won't include a very strong digital component, and let's hope a focus on adult vaccination beyond COVID and including flu and pneumococcal and various other protections that are available. So I'm so sorry that we ran out of time. And thanks so much to all the speakers, to everyone who contributed, and to all of you for joining. I hope you enjoyed it. We will share these questions with the panelists in case there's any specific responses some of them want to share. But for today, that's all from me. And thanks again for being with us. Thanks.
Thank you.
Thank you very much.